National University Surgery Society. We're here to talk about the recently concluded Association of Surgeons of Uganda surgical camp in Greater Ankole region that took place from 22nd September to 28th September 2024. With me here I have Dr. Musinguzi Brian, a senior surgeon and the general surgeon coordinator of the camp at Ishaka Adventist Hospital. Nice to have you, Dr. Musinguzi Brian.
Thank you for coming to Ishaka Adventist Hospital. And I'm called Dr. Musinguzi Brian. I'm a general surgeon by practice. I work with Ishaka Adventist Hospital as the medical director, which was chosen to be among the hospitals in the Ankole region to conduct this mega surgical camp for Association of Surgeons of Uganda. We were lucky to be given a chance to conduct specialized surgical services at this hospital, and we were happy that this service finally came to pass because the burden of surgical services in the Ankole region has been high, since we all know that surgical services are quite expensive.
So let's talk about the camp. What was the overall goal?
For this camp, mainly as ASOU, was to bring surgical services closer to the people, especially those ones who are in the community. And we're mainly targeting those ones in the country communities where specialized surgical services are very difficult to access, are very expensive, and the surgical specialists who do those things are not around in these areas. So the main focus was to bring these surgical services to the common person in the village and at a free cost.
That was a great insight, Dr. Musinguzi. Now, our listeners would like to know how many patients were treated during the camp. How was the turnout for the camp?
Thank you for that good question. As we know, the turnout for the surgical cases has been high in all hospitals. And for Ishaka Adventist Hospital, we worked on 27 cases. And because all these were specialized cases, Ishaka Adventist Hospital mainly worked on endoscopies and colonoscopies. And these ones mainly detect the diseases of cancer of the esophagus, ulcers, cancer of the stomach, and other abnormalities within the upper GI, and other abnormalities in the lower GI where we have cancer of the colon and the rectum. The number of people who turned up the whole week, we are really conducting all these services. So the turn-up was good and the success has been good. And to add on, this camp was a bit special because even those ones whom we had to take biopsies from their masses that we had were there at this moment for free, and were being taken and were analyzed to do the same very
Dr. Musinguzi, I'm curious to know if you happen to get any complex cases, and if so, how did you manage them?
As we all know, surgery is complicated. During last week when we were conducting the colonoscopies and endoscopies, we came across one case with a patient who had a tumor within the larynx. It was difficult for us to navigate and go through to see what is happening below the tumor. And we were lucky that we had a competent team of anesthesiologists who helped us to manage this patient who developed difficulty in breathing after the endoscopy was introduced. And we were able to manage them from our HDA unit. It was only one patient, and after that we recovered after 2 hours. And we thank God that this happened and the team was ready to help us.
Dr. Musinguzi, the last question. What do you think the Association of Surgeons of Uganda and their partners should continue to do in order to bring about and improve access to quality surgical services in Uganda?
Thanks for that good question. I will answer it by starting giving us what we can do to improve on the camps, and secondly, what we can do to improve on surgical services as a country. It is a very good idea to bring surgical camps, especially in regions, because of lack of surgical services in most of the regions that we have in Uganda. And as I had said in the beginning, most of the specialists are in towns, like in Barara, they're in Kampala, but deep down in the villages, they are not there. For the surgical camps, I request that we as a ASOU have better preparation, especially in terms of supplies, because we discovered that supplies are not sufficient enough. So we need more lobbying on that side. We also need more lobbying on social welfare of the staff that work in these camps, because we discovered that we got some hiccups in feeding, in accommodation, especially for the specialists who come and those other people whom we find on the ground and they are participating in the camp. because the camp is laborious, it has very many patients. People work the whole day, they get so tired, and at least they need a good rest. So that they can prepare and rejuvenate for the following day. Otherwise, if you don't pay attention to that, by the third day, people get exhausted and they don't work as far as the way they started. So that is an area we need to look into, feeding and accommodation. And after that, we need to also plan for the supplies so that it can be enough, because sometimes we become overwhelmed. The challenge is when you're planning for a camp, it's like when you sit to plan for a funeral, you don't know how many people will turn up, no cards, but I know we have the capacity to participate and know how many people are coming. So I call upon these organizations that really have that can sponsor us, especially with health supplies, drugs, gloves, some equipment and instruments to give us a hand in this. Also let the government, especially not only leave it to the MPs, but let other sectors or ministries also help us in this, because we all need this health care for the economy. At the level of the surgeons, we also request that if there are organizations that can start running our medical students, our doctors, scholarships for surgery, and especially specializing in surgery, that will be a great help to the nation. Because at the moment, yes, we have a good number of general surgeons, they are still few, but super specialized, we are very few. So we request that if there are scholarships that can be available to pay for the tuition and welfare for the person who has studied. Because we discover people who go for these fellowships, they are a bit old, they already have families. When you provide only the scholarship, the tuition, it may not be enough for this person to look after his family. We also keep them in the last night.
Dr. Musinguzi, let's talk about you being a surgeon. What time within you growing up, at what time did you realize, yeah, I think I'm going to be a surgeon?
Thank you very much for that question, because to practically say it is being a surgeon, I realized it when I was in medical school around third year, because me as a person, I like doing things that I see we get results. And I discovered that when I was in surgery rotation, this is what was happening. Someone comes with a challenge, you sit down, they say do an intervention, and you see and improve. Then after that, when I had finished medical school and I was in pre-internship, one of my relatives was doing retention, and we went to the hospital, and I saw how he was suffering and struggling with life, and how an immediate intervention was what happened when he got to live there and then. That's when I made my decision. Indeed, if I want to help people who are deep down in the community, I need to go and do surgery. And I want to thank God that I got the chance. I started from care, I used my master's in surgery, and I completed. So that is my work.
They are clinicals, others are in pre-clinicals, while others are residents. What word of advice would you be able to give them in case you met them? What would you tell them?
Wow, I think I wish I had such a question or such a chance to hear that counsel from someone who has been my residence. But what I want to talk about surgery as surgery is not in books. Surgery is not found on YouTube. Surgery is not found on internet. Surgery is on patients that we meet in our wards. Surgery is on that table that you do. A surgeon, you need to know everything. You know, most people tend to think that surgeons, they think all the time cutting. But as a surgeon, you need to know both all internal medicine and you have to add on the surgery, because you need to know before I intervene what else can be happening in this patient. Is it the right time to intervene or not? I also need to know my intervention that I'm going to do, is it going to be of benefit? Because we should all know that at the end of the day we swear that do no harm, and that is our baseline. So, and as a surgeon, if you want to become a surgeon, you need to be practical, be hands-on. Otherwise, if you don't be hands-on, you may go read all the books, have the knowledge in your head, but when we give you the knife, or not just the knife, these days there are other equipment, you may not accomplish what you're planning to do. So, if you are in preclinicals, if you are a resident, even us who are qualified as surgeons and want to continue adding on, more practice, hands-on is what makes a good surgeon. Thank you very much.
So Dr. Musinguzi, I'm curious to know, if you weren't a surgeon, what would you be?
That's a very tricky question, because the passion I have for surgery closes my mind from thinking about other disciplines. However, in practice, I think if I wasn't a surgeon, the first priority would go to being an intensivist. And that one requires me to do anesthesia. So you see, these ones are connected to surgery. Another one is being a radiologist, because we discovered that our imaging department in Uganda is still lacking. We have very few people interpret the graphs that we take are few. And if we can go on and do interventional radiology or nuclear radiology, that is the area I would venture into. Thank you very much.
Alright guys, I've been talking to Dr. Musinguzi Brian, the medical director at Ishaka Adventist Hospital, and he was the general surgeon coordinator for the recently concluded surgical camp. Thank you so much for everyone. Be sure to subscribe, follow us on Instagram, LinkedIn, and also YouTube. Thank you so much. It's been a pleasure to talk to you.
It's been my pleasure also to having this interaction with you.
All right.
And you're always welcome to Ishaka Adventist Hospital.
Thank you so much.
Thank you.